Well, good morning. Welcome to a nice freezing springtime day here in Austin. And Gavi, thank you so much for that introduction. Well, my office is on 6th Street, not too far from here, and I'm always delighted to hear the wonderful music that basically travels down that street coming towards my office. And for one, I myself play the flamenco guitar, and I'm just waiting for that invitation to perform at one of these venues. Maybe something big and bold like the auditorium shores, but in the meantime, you're going to hear from me to talk about why higher education is so big and so bold in Texas. Let me begin by giving you a picture of the University of Texas system. There are 15 institutions in the UT system, 9 academic institutions, and 6 health institutions, and they basically span the landscape of this great state of Texas. UT Austin is ranked as one of the top 16 public universities for undergraduate studies in the United States, according to the 2014 U.S. News and World Report, and we are very proud of that accomplishment. University of Texas MD Anderson is regarded as the best cancer treatment center in the world. Again, a part of the University of Texas. The UT Southwestern Medical School is ranked in the top 25% nationally in both research and primary care, and its faculty has produced 5 Nobel Prize recipients and now has over 19 members in the National Academy of Sciences. University of Texas El Paso produces the most Hispanic PhD graduates in the nation and is also the top producer of graduate-level Hispanic engineers. Again, we need to be sensitive to the changing demographics of our nation. All total, the University of Texas system has 213,000 students, more than 19,000 faculty members, 69,000 staff members, and a collective budget of nearly $14 billion. This is one of the greatest assets that the state of Texas possesses, not only for ourselves, but for our future. Last year alone, we produced more than 30,000 undergraduate degrees and more than 15,000 graduate and professional degrees. Nearly $1.4 billion was allocated for financial aid because we want to make certain that no student is denied a higher education because of socioeconomic challenges. Chances are that as you walk through the Austin streets today, if you see a doctor or a nurse or a healthcare provider, you are meeting a University of Texas graduate. We produce 2/3 of all health-related degrees in this great state. Our hospitals and our clinics serve more than 6 million outpatients a year and about 1.35 million hospital days of treatment every year. So even as I'm speaking here today, the healing hands of our providers are saving lives. A little bit about research. The annual research expenditure at UT system adds up to about $2.54 billion, making us number 2 in the nation, behind only the University of California system. And I'm really optimistic about the innovation that will be occurring here in Austin as a result of the Dell School of Medicine. Among our faculty members system-wide, we have 7 Nobel laureates and 277 members of the prestigious national academies, and for the 2nd consecutive year, philanthropic support for the University of Texas system by grateful patients, grateful alumni, and those who believe in education has topped $1.2 billion. Another issue that I'm really proud of, especially as a parent who has still a daughter in higher ed, is also that the tuition for our students is still among the lowest in the United States. And if you compare, let's say, a medical school degree at Southwestern costing about $14,000 a year compared to another public university system outside the state or a private medical school, we're talking between $40,000 and $50,000 a year. So again, we are doing our part to bend the cost curve for higher education. The state of Texas has had a unique history in the development of higher ed, and the University of Texas and the UT system institutions have played a major role in that development. This state has benefited from the vision and the wisdom of educators and many responsible legislators who foresaw the need of a great university and medical school to educate the future leaders of our state. In fact, in 1876, the Texas Constitution specified that the legislature was to establish and provide for the maintenance and the support of a university of the first class, to be located by the vote of the people. In 1881, Texas voters chose Austin for the site of the main university and Galveston for the location of the medical school. And you might ask, why in the world did we separate the academic university from the medical school? Well, again, it was a decision made by the voters of Texas, but in regards to the medical school, Galveston in 1876 was the busiest city in Texas, where immigrants from all over the world would come in with a variety of illnesses and ailments that required the care of providers. And that's why we called it the University of Texas Medical Branch. Another major outcome of the Texas Constitution of 1876 was the establishment of the Permanent University Fund. We usually refer to it as an acronym called PUF, and it is a public endowment that provides financial support to our institutions in the University of Texas and Texas A&M system. Today, more than 20 Texas institutions benefit from this endowment, and I'll tell you a little bit more about it. In my way, as chancellor, the Permanent University Fund is really a thing of beauty, with an impressive diversity of revenue streams from those 2 million acres in West Texas that were set aside by legislators for higher ed. The principle of the fund now includes all proceeds from oil, from gas, from sulfur, and from water royalties, all gains on investments, mineral leases, hunting leases, grazing leases, vineyards, wind power, and all amounts received from the sale of university land. Now, I've gotten to know the legislature quite a bit over the past, since the year 2000. I think that when they gave us those West Texas lands, those 2 million acres, they had no idea what the resources of those West Texas lands were going to have. I think they thought it was desert, and they said, here's something, don't come back to us, for any more requests for the next 4 years. Well, let me just kind of tell you a little bit about how this story unfolded. So I personally have an affinity for Ashbel Smith, who was the first president, or really the chairman, of the University of Texas's first Board of Regents, who is really known as the father of the University of Texas and also the father of Texas medicine. He was, even as chairman of the board, a practicing physician. And during Galveston's epidemic of the yellow fever in 1839, he treated the sick. He published reports about the disease in this Galveston News, and he wrote the first treatise on yellow fever in Texas. As a result of the leadership of Ashbel Smith and his colleagues in medicine, Galveston has been a center of medical education since before the Civil War, especially in the areas of infectious diseases. So it's no surprise that we have a national center for infectious and emerging diseases, which is a national lab, on University of Texas Medical Branch's campus. I might also add that the University of Texas Medical Branch in Galveston has always been a leader in diversity, which has also been a very important component of my framework. That is, we need to educate a population of students that reflect the face of Texas. And in fact, the very first African-American student and the very first Hispanic student in Texas was educated at the University of Texas Medical Branch, and to this day, remains a champion of diversity of health professional education. I admire Ashbel Smith because he was a steadfast supporter of education at all levels, whether it was K through 12, whether it was undergraduate or medical education. And he had none more than higher education and medical training. I mean, that was his real focus. At the ceremony to lay the cornerstone of the old main building on what would become the University of Texas campus, Ashbel Smith said something that was really quite prophetic. Smite the rocks with the rod of knowledge, and fountains of unstinted wealth will gush forth. Well, he was a grand orator, but he was also had a very well-phrased metaphor, because Asheville Smith had no idea that 40 years later after that statement, in 1923, oil would be discovered on university land in Reagan County, where the Santa Rita oil well gushed forth fountains of wealth. And to this day, that first oil well is still producing oil. The 2 million acres of West Texas desert and prairie lands that the state legislature gave to the people of Texas as an investment for their public university became what I call the miracle of the University of Texas endowment. From desert to oil and gas. As an interesting footnote to the story, the Board of Regents actually, during the Depression, was considering selling some of this land from West Texas because they actually were losing money just for the maintenance of the land. And as usual, presidents come to the board always asking for funds, and they didn't have any. And so there was a serious discussion about selling a significant portion of the West Texas lands. Well, there was a geologist by the name of Johann Uden, who was at that time serving as the director of the university's Bureau of Economic Geology. And he convinced the chairman of the board then that, maybe it's not a good idea to sell this land. There's something that tells me that there's oil and gas, and really I'm strongly suggest to you to take this off the agenda. Well, thank goodness the chairman of the board did take it off the agenda, because otherwise the University of Texas would look very different today. So one person does make a difference as to the future of a university, and in this case, Johann Uden was really a champion of many of the great successes that we've appreciated today, because if we would have sold that land, that would have really resulted in many lost opportunities, for so many students and faculty and so forth. So no doubt that striking oil was an astounding moment in the history of higher education in Texas. By 1925, the Permanent University Fund was growing by more than $2,000 a day. And today, new technology has increased production on these lands, and our UTIMCO investment team, which really manages our investments, has invested in these funds with extraordinary success. At the end of January, this past January, the Permanent University Fund was valued at about $15.73 billion, and it's our students and our faculty in the state that are the direct beneficiaries of this endowment. There is nothing like the Permanent University Fund in the United States. So there's no doubt that we are unique. We are incredibly blessed to receive significant financial benefits from the land itself. And in a real sense, the West Texas lands and the Permanent University Fund have impacted people. And what do I mean by that? Well, we've all heard about MD Anderson Cancer Center. And MD Anderson would not be the #1 cancer center in the world if it wasn't for these precious dollars coming out of this endowment that have supported the construction and the recruitment of gifted physicians and faculty. The Permanent University Fund has built centers for the arts, the performing arts, and culture. So many of the buildings that you see at UT Austin or many of our other campuses have been built as a result of the Permanent University Fund. When you take a look at Southwestern Medical Center and you receive a artificial heart to bridge you to heart transplantation, well, a lot of that research was funded by the Permanent University Funds. So it's easy to just get stuck with investments and portfolios and so forth, but I just want to reflect to you what this means to people. And there's no doubt that this fund has saved thousands of lives and have educated thousands of leaders for our state and for our nation. Today, 135 years after the Permanent University Fund was created, the University of Texas system has 15 institutions that are educating and recruiting a new generation of students and doing world-class science that is improving the quality of life for our state and for the world. Now, there's no doubt that the UT system has an enormous amount to celebrate. Our institutions are strong, and they are world-class, following their own trajectories of excellence, and one size also doesn't fit all. But as we all know, quality is a moving target, and we can't stay idle or still. And so 3 years ago, the University of Texas system underwent a self-examination of the ways our institutions were performing, and then also asking us, how can we do better? If you believe in a philosophy of continual improvement, then every day you've got to basically be introspective and ask the question, how can we do better? Well, since the summer of 2011, with the dedication and the hard work of my team and the cooperation of our presidents, the UT system has embarked upon several initiatives that are changing the environment of higher education. We have become a model not only for Texas, but for the entire nation. And let me just give you a couple of examples. So the Framework for Advancing Excellence was our effort to address a number of challenges in higher education and also position UT institutions among the best anywhere. As you know, there have been great debates about higher ed, and I felt we ought to be front and center in that debate, put forth constructive solutions, and that was the genesis of the Framework for Advancing Excellence. I'm happy to tell you that we are nearly 100% complete on that framework. So let's talk about undergraduate student success and access as well. We're striving to increase the numbers of degrees conferred. I mean, we all want our students to go to college, but at the end of the day, the true outcome measure is, did you get a degree? We want to improve four-year graduation rates. We want to make certain that we provide paths of success for our students. And at the same time, we want to reduce the financial impact of higher ed on students and their families, and then also utilize blended and online learning and other venues that allow students to be able to capture credits even while they are working in the oil fields in the Permian Basin. We also understand that to be a great university, you've got to have the very best faculty and staff. And so we are doing that by attracting and retaining the very best faculty through the creation of prestigious academies and also other incentive-based strategies that we utilize based on the permanent university funds. And so we have a fund called STARS funding that allows us to recruit some of the best faculty from around the world. And in fact, just 2 years ago, we recruited Dr. Beutler from the Scripps Institute in California, and within the same year, he won the Nobel Prize. We're promoting science and advancing technology commercialization, building partnerships with private companies because we know that traditional revenue streams are becoming constrained, and so therefore, are there more innovative ways of partnering with industry without compromising academic freedom and also addressing any conflicts of interest? We're implementing cost containment strategies, looking for ways, again, to basically reach our dollars further, like we have to do in our own households. And we're also understanding that in the world ahead, that to basically lead either in education or in healthcare, we have to understand big data, which means we need to be on the leading edge of high-performance computing. And so we're investing in that. And at the same time, you can't be a great university without philanthropy, and many of us become presidents not understanding how to raise money. And in fact, we have multiple symposiums basically educating us on how to nurture donors and relationships such that you can actually present the very best case to be able to get philanthropic support for your mission. Another area that we embarked upon was how do we actually mentor and advise our doctorate students, those pursuing PhD degrees? How do we shorten their time to completion? Why is it taking 7 or 8 years to get a PhD degree? And in fact, we are one of the very first university systems that now have basically letters of understanding, which clearly outline the responsibilities of the professor and the responsibilities of the graduate student as to timelines and benchmarks and expectations, such that you can get a degree, your doctorate degree, in time, and that we can also connect you to employment, whether it's in the academy or whether it's in the private sector. We're also advancing medical research in Austin and other metropolitan areas. We also focus a lot on patient safety because, you know, I don't know, if I'm a patient in a hospital, I want to make sure that the care I'm being provided is done in the safest, you know, environment, and that, you know, patient outcomes are really monitored clearly. And so we have become leaders in patient safety and clinical outcomes. And then also, I felt very strongly that South Texas is one of the fastest growing regions of the state, one of the poorest from a socioeconomic perspective, challenged in the state, and nearly 95 to 98% Hispanic population. I wanted, when I became chancellor, to plant a larger flag in South Texas to make certain that this area of the state also has great opportunities. So I'll talk to you a little bit more about that in a few minutes. Well, let's talk about the University of Texas Board of Regents invested $50 million to support the Institute for Transformational Learning, which is really, again, working with our academic and our health campuses to establish the University of Texas system as a global leader in blended and online learning. And this academic year, UT Austin is offering 9 massive open online courses, otherwise known as MOOCs. And in fact, in our very first year, we're approaching about 175,000 students worldwide who are learning from our faculty. And so if I take this a step further, and let's just talk about higher education along the Texas-Mexico border where resources aren't abundant. Well, what if we can bring the very best faculty from either the UT system or the world to come and help augment our wonderful faculty, at our border campuses to basically bring the best of museums, the best of the humanities, the best of lecturers to help augment the classroom in our universities in socioeconomically challenged regions. I really think, we can do far better in how we educate our kids. We're also honored to be the first public university system in edX, a not-for-profit consortium that offers online interactive learning. And edX was founded by Harvard and MIT, and they've since added UC Berkeley and other institutions. And we're using the edX platform in a variety of ways to enhance technology and to bring the very best that we can to all our students throughout the state. Another initiative that we embarked upon was a transformation in medical education, otherwise known as TIME. And what I mean by that is that we've launched pilot programs that partner our 6 academic campuses and our 4 medical schools to offer a student-centered, clinically focused curriculum that is 1 or 2 years shorter than the traditional 8 years required to get an undergraduate medical degree. So this program streamlines a medical curriculum that really has not been updated since the Flexner Report about 100 years ago. How can we produce doctors in a shorter and more efficient time frame and lower the total cost of medical education, thereby reducing medical debt? So the average debt of a student who graduates from medical school is about $200,000. That is a lot of money. And, is it possible to do 3 years of undergraduate education and then upon successful completion of your first year of medical school, receive a baccalaureate degree, and then basically compress your time frame from 8 to 7? And in some cases, you can compress it to 6 years without ever compromising excellence. We also realized that there is a great demand for engineers, not only in Texas, but in the United States. And so we embarked upon a task force on engineering education for Texas in the 21st century. And we really examined the current state of engineering degrees that we offer in Texas. And we also worked with the Texas Workforce Commission to find out, how many engineers do we need in the state of Texas over the next 10 years? I can personally give you the answer for how many new doctors we need in Texas over the next decade or 20 years. But I received that question for engineers, I had no idea. Well, the answer is, in order to address the demands of the state of Texas right now, we need 9,000 new engineers and computer specialists every year for the next decade. Far, far below the numbers that are currently being graduated. So, we have embarked upon a task force that has provided us recommendations where the University of Texas will educate an additional 4,500 students a year over the next 10 years to be able to meet this demand. And right now we have a working group determining how do we actually now execute on these recommendations. Now, the University of Texas Clinical Safety and Effective Program, which I just spoke to you a little bit about, offers a 5-month course on clinical safety for all our faculty and our staff at our 6 health science centers. The board allocated $8 million to support the program in integrating quality and safety concepts into the way our medical and health professionals do their work every day. There are best practices here that we can actually improve patient outcomes. In fact, at UT Health Science Center, Houston, now over the past 6 years, they have not had a single case of a hospital-acquired pneumonia from being on a ventilator. And that is really basically practicing some of the lessons learned out of patient safety and clinical outcomes. We've also, again, I've got a great affiliation to our faculty. They're the heroes. I mean, our K through 12 teachers are heroes. Our faculty are our heroes for inspiring our future students. So I felt very strongly that we needed to establish an Academy of Master Teachers which recognizes outstanding educators at our 15 campuses. The Academy fosters excellence in teaching and creates opportunities for continuous learning and scholarship at our universities. The Academy also supports innovation in teaching, including blended online learning, and then having our faculty learn from other faculty members. So as much as the UT system and the Board of Regents have accomplished over the past 3 years, and those accomplishments are substantial, there is still much ahead of us to strive for and complete. And I just know, growing up in a family of 10, we've got to actually honor those who are doing great work. And again, what an opportunity to reward our great faculty by becoming members of a Master's in Teaching Academy. Now, one of the most exciting and new developments in Austin and Central Texas is the establishment of the Dell Medical School at the University of Texas at Austin. This has been supported by a significant lead gift from the Michael and Susan Dell Foundation. Now listen to this. This will be the first medical school to be built at a AAU university or a research-intensive university in the last 50 years. I promise you it's going to transform the healthcare in Central Texas, and in fact, with the addition of medical education, I truly believe that UT Austin is poised to become the #1 public research institution in the nation, making Austin one of the great centers for biomedical research. I still get goosebumps about it because I just know it's going to happen. And then coupled with UT system initiatives to support technology, innovation, and entrepreneurship, Austin will be one step closer to becoming a major technology hub like Route 128 in Boston, the North Carolina Research Triangle, and Silicon Valley. You put a School of Medicine at UT Austin together with their engineering school, together with their College of Science, and connect that to the School of Public Policy and the School of Law and the School of Pharmacy, you've got real opportunities for dramatic innovation and policy recommendations for this country. Now, we've recently selected a new dean for the Dell Medical School, Dr. Clay Johnston, and Dr. Johnston is a physician and a professor of neurology and epidemiology who comes to us from the University of California, San Francisco, where he is currently a vice chancellor for research at one of the very top academic medical centers in the nation. Well, we are also, as I've stated, I wanted to plant a larger flag in South Texas, and we are moving forward with our plans to create a new university and a new medical school in the Rio Grande Valley. Now, how can you do this? Well, the reason why we can do this is because of those permanent university funds I spoke to you about. The lower Rio Grande Valley is the southmost region of Texas, and it's kind of a sort of a V between the Rio Grande Valley and the Gulf of Mexico. It is an area in Texas where the population is growing extremely rapidly, but where current opportunities for upward mobility are a bit limited. And what do I mean by that? So I just want you to consider these facts. So the current population of the valley is 1.26 million, and by 2020, the population is projected to grow another 1.5 million people. In fact, in Texas, there are 1,200 new citizens coming in every day to the state of Texas. So in higher ed, we have to begin to start accommodating for this. The valley is 90% Hispanic compared to 38% Texas overall. Among adults older than 25 years of age in the Rio Grande Valley, only 15% of students in the valley have college degrees, compared to 26% in Texas overall, and even the 26% is not adequate to address the needs of Texas. In the valley, there are 500,000 children and 47% of them live in poverty, compared to 27% statewide. In regards to health professional workforce, the Valley has 107 physicians per 100,000 residents, compared to 195 physicians per 100,000 in Texas, and a national average of 220 physicians per 100,000 population nationally. So the Valley, in short, has about half as many doctors as it should have by national standards, with a growing population at hand. There are also systemic health factors affecting Valley residents, including a disproportionate rate of chronic and infectious diseases. For example, tuberculosis in the Valley are twice the rate of Texas overall, and nearly 3 times as high as the nation. The major populated metropolitan area of the Rio Grande Valley also suffers from what I call an epidemic, and that is the epidemic of obesity. Nearly 10% of adults in Texas have been diagnosed with diabetes, but the rate of diabetes in the Valley is higher, almost approaching 15%. And in regards to the comparative effectiveness research on cancer in Texas, there are reports that cancer has surpassed heart disease to become the leading cause of death for Hispanics in Texas. And the report indicates that this is also a case in the Valley. And then 38% of the Valley's population does not have health insurance today, compared to 24% in Texas and 15% in the nation. So, as these statistics show, the Rio Grande Valley, there is an increasing need for doctors and health professionals, nutritionists, teachers, and a myriad of other professions that will improve basic services, educate children, and grow the economy of this great state. Well, for several years, our board has been striving to plant that larger flag I told you about in South Texas, in the Rio Grande Valley to be specific, to address these challenges that I've conveyed to you. These are the very same facts I presented to the board nearly 5.5 years ago when I became chancellor. Well, as the centerpiece of our commitment, I am a bit tenacious. The Regents have funded a new university and a new medical school that will span the entire Rio Grande Valley, with a presence in each of the major metropolitan areas of Brownsville, Edinburgh, Harlingen, and McAllen, immediately making this new university one of the 2 largest Hispanic institutions in the nation with a medical school. So, what became an idea only about 19 months ago has now been approved and has been funded by the Board of Regents and passed by the Texas legislature and signed into law. And that is kind of a record accomplishment of being able to get that done in less than 2 years. And again, only in Texas can you do this. Well, the university in the Rio Grande Valley has a new name, and it was approved by the people of South Texas in the Rio Grande Valley. Our new university will be called the University of Texas at Rio Grande Valley, or UT-RGV. And just a little story about this, because we did use a lot of social media to determine what is the best name for a university in South Texas. And so we heard from a lot of students, and we just heard from a lot of people. And I guess the most telling little story is that one student from UT Pan Am actually emailed me, and I actually called him. The following day I called him, just on his phone. He got terrified that it was the chancellor. He thought he was going to get expelled or something. And I said, no, I just, I read your email, I was touched by it, and you told me that there are many people in the colonias, which is a very impoverished part of various regions. They don't have running water, they don't have telephones. How are you going to communicate with students in the colonias? I didn't know the answer. Well, anyhow, I actually turned it around to him, and it said, can you help me communicate with the students in the colonia to help us with a name? And actually, they sent out delegations to the colonias to also get their input. And I thought that was, also just kind of the caring type of students that we have. Well, in regards to the medical school in South Texas, 2 weeks ago we named the new dean of the medical school at the UT Rio Grande Valley. Our founding dean is Dr. Francisco Fernandez, professor and chairman of psychiatry and neurosciences, who currently is at the University of South Florida College of Medicine in Tampa. So we're very excited to welcome Dean Johnston at UT Austin and Dean Fernandez in UT-RGV. And a search has also been underway to hire the founding president of the University of Texas at Rio Grande Valley, and we will announce our selection in the months ahead. Well, what I didn't mention earlier when I was describing the beauty of the Permanent University Fund is that only 2 years ago, actually less than 2 years ago, 13 of our 15 institutions were eligible for permanent university funds. So when I became chancellor, actually even longer than that, I knew that even though you had University of Texas in front of your name, and even though these permanent university funds excelled and expanded excellence across UT, there were 2 campuses that just could not receive those funds. Well, where were those 2 campuses? In South Texas, UT Pan Am, UT Brownsville, one of the most socioeconomically challenged areas of the state, and a population that is in excess of 95% Hispanic. It just didn't settle right with me. And I kept on asking, well, why is this the case? And the case is that it was in the Constitution that, if you actually acquire a university, you're not eligible for PUF. And I kind of scratched my head. Well, what do you mean by that? Well, we acquired UT Brownsville and UT Pan Am as community colleges in their infancy. And so we changed it from a community college to a university, but because of that, and because of the Constitution, they weren't eligible for PUF. Well, we hit a real crisis, which is when the community college separated from UT Brownsville about 2 years ago. Suddenly, UT Brownsville lost nearly half of its revenue. And here I am, the first Hispanic chancellor in the history of UT, and I'm seeing a campus in South Texas dissolve and not have the financial wherewithal to survive long term. I go, this is a disaster. So, crisis management, got everybody around the table, and I asked, well, what can we do? And everybody scratched their heads. Well, finally, a parliamentarian by the name of Steve Collins, who was a parliamentarian for the legislature for over decades, he said, well, Chancellor, you can do something to make it PUF eligible, and that's just create a new university. I said, what do you mean by that? Yeah, just bring UT Pan Am, UT Brownsville, build a medical school, get the legislature to designate it as a new university, and then you'll be PUF eligible. Well, that's exactly what we did, and just 2 months ago, we allocated over $300 million to our efforts in South Texas. And again, it's literally turning a crisis into a massive opportunity, and at the end of the day, it requires teamwork to get there. And again, that is one of the great human impact stories that I've been able to be a part of. Well, in closing, Daniel Burnham, one of America's premier architects at the beginning of the 20th century, once said, "Make no little plans. They have absolutely no magic to stir men's blood and probably will not themselves be realized." And boy, have I learned that lesson as chancellor. So, at UT System, we don't like to make little plans, and that has become a guiding principle. The stereotype of Texans is that we are given to exaggeration, but it is no exaggeration to say that the aspirations of the University of Texas institutions are big and they are bold. So every day at our 9 academic institutions and 6 health institutions, we're implementing innovations that create a stronger learning environment, improve the undergraduate experience, contribute world-class research, render public service, that is, our impact on the community, and transform lives in this and future generations. That's what makes me tick every morning. I can tell you that I have been one of the luckiest human beings on this planet because it has been such a great privilege to serve as chancellor of this outstanding system of higher education for over the past 5 years, and to join the regents and thousands of faculty members and administrators and alumni in their pursuit of excellence. So when I started my job as chancellor, I came up with 5 goals. Actually, 5. And it was what I conveyed to regents at a retreat. I said, I want to position UT Austin as America's finest public university. I want to help our emerging research universities have an opportunity to become Tier 1. I want to plant a larger flag in South Texas. I want to improve the health of Texas. And I want us to be real leaders in the areas of engineering and energy. So, the medical school is going to position UT Austin as America's finest public university. We have really excelled in our 4 emerging research universities, and they're making great ground to establish themselves as a Tier 1 university. Texas only has 3 research-intensive universities: UT Austin, Texas A&M College Station, and Rice. California has 9, New York has 7, and our total population probably exceeds those 2 states. So by any measure, we need additional Tier 1s. And so I think we've made great strides there. Third, improve the health of Texas. Well, we've done that with our 6 health institutions, but you had 2 new medical schools. I think we hit that one out of the park. Fourth, plant a larger flag in South Texas. I don't have enough trucks to carry that flag right now to South Texas because it's a very large flag. And I think we have transformed the future of South Texas through these initiatives. And then finally, I think this task force on recommendations of how we're going to educate 9,000 more engineers per year for the next decade. I think we've set a bold plan to execute. Now it's a matter of really putting our resources and budgeting that, and that's going to be another great opportunity. So I think that I've accomplished my goals and my stretch goals, and it's time for me to go back to save one life at a time. And so I will be going back to the Health Science in San Antonio in September to become the head of pediatric transplant surgery in San Antonio. So I've had a great ride. We still have miles to go. The people of Texas expect us to deliver the very best higher education in the country, and I promise you, we will not disappoint them. I want to thank you and South by Southwest EDU for giving me this opportunity today, and I'm happy to take any of your questions. So thank you. I'm all ears. Anybody? Yes, sir. Can you stand up because I've got a hard time hearing?
Anthony Edwards, and you mentioned that MOOCs and edX, like online blended education. Do you all have any goals as far as degree completion through online courses in the system?
Yeah, we do. I kind of see all of this kind of in a very simple way. I'm just a surgeon, all right? So, just like a financial portfolio, I believe we've got to have a portfolio of blended and online courses, including competency-based planning. So the massive open online courses are a part of the portfolio. And those are accessible to the world. Anybody who wants to learn about energy, come to our MOOC. Now, if you want to get a certificate of completion for that MOOC, then yes, you're going to have to pay a little bit something for that, and we will give you that, but you'll have to pass an exam and so forth. So that's a MOOC. Now, we also understand that when you take a look at what are some of the barriers of graduating in 4 years, when you talk to students, they tell you, I could have graduated in 4 years, but I couldn't get into, that important section that I needed. And I can't do it in the summer because I got to work. So now I got to do it, the following year. Well, if you really are a system of higher education like UT, that should not happen. We should be able to offer that key course in an online format by an outstanding teacher, and you should be able to get credit for that. So, that's the other part of the portfolio, is how do we do that, and we're working on that. The third is, as we are taking a look at South Texas, and we're creating this new university, do we want to create this new university the way we've created everybody else? I don't think so, because there is a great opportunity for technology to augment the classroom and the teacher, not to replace them, but to augment. And so we're actually working with the dean of the medical school now to determine, does he or she have to recruit 10 departmental chairs for A, B, C, and D, because that's where we've always done it, or just actually have Health Science of San Antonio, provide some courses through technology that our students in the Valley, because they're going to have to be all over the Valley since it's a multi-regional campus, can they learn some of this through their mobile devices? And then have more of a kind of blended environment through seminars? Well, the answer is yes. And then imagine that, one of the greatest costs in higher ed are facilities, bricks and mortar. Well, can we actually lower those costs through different formats? It's not to say that technology is not expensive, but it is to say that maybe the investments are not so much the way we have in bricks and mortar, but maybe it's in high-performance computing and technology. So what we're trying to do at UT is establish a portfolio of offerings in the traditional classroom, MOOCs, gateway courses, competency-based courses, and I think if we give great options to our students, they're going to figure out the best path for themselves. That's kind of my philosophy on that. Yes, sir.
Chancellor, thank you for your service. The Hispanic completion rate in Texas right now is 9%. What would you like to see that in 10 years?
In 10 years, 100%. But that's not going to happen. One of the figures that it hurts me is that when you take a look, just take away ethnicity. Let's just take a look at the lower quartile of socioeconomic base. So if you live at the 25th percentile of, you're living in poverty. You're at that lower 25th percentile. In 1970, the chances of you getting a baccalaureate degree was 7%. In 2013, it's 9%. And everybody else has advanced, which means we have to do things differently. And that is, again, how do we actually utilize new methods of teaching that can have a high impact on these students? So again, blended, online, so forth. A lot of these kids have to work. They just can't come to college. So can we bring the college to them as an option? Second is, how do we actually keep bending the cost curve for higher ed? I think we've done a large part, but we need to offer more work-study programs such that students can actually work on campus rather than not be on campus, and make it easier for them to work and study. The third is we've got to do better in making sure that the students that we do accept, that they don't require a tremendous amount of remediation. So we need to do better in partnering with K through 12 and community colleges such that we have every confidence that you're going to succeed. And we also have to build confidence. I mean, confidence is a very important word in our students. I can tell you, when I left Laredo, Texas, the poorest school district in America, and be dropped off at Yale, thinking I was a top student, only to quickly find out that I was at the bottom of the pack, you lose your confidence pretty quickly. And so again, how do we build, confidence, in those leadership skills in our kids? So it's we've got to improve that statistic, but there's not one simple answer that's going to do it. It has to be a comprehensive approach. And I think in education, I'm a big believer that we got to break away the silos of K through 12, community colleges, and higher ed. We're all in that together, and in regards to outcomes, we ought to be held accountable as a unified approach on that front. And I always call it prenatal through 16 rather than K through 16. It's also our family environment and our support systems to get us through. So all of us are responsible for the success of our kids. I know I didn't completely answer your question, but it's everybody has to be held accountable for that. Yes, sir.
You mentioned developing confidence. Inquiry classes have a way of doing that. I know that UT Austin has embraced that.
Inquiry?
Inquiry, yeah.
Okay.
In classrooms. UT Austin has embraced that pretty extensively with Dean Hickey's plan and CMS. Do you have suggestions of how to get more professors in the UT system to take an honest look at that and try it in classes?
Well, I haven't come up with a plan, but I think that's been the philosophy of developing the teaching academies. That is the Academy of Master Teachers, for them to share, best practices. And then also for teachers to understand that not everybody comes in with the same confidence level. I actually, this is an N of one, which is me, but if it happened to me, it's going to happen to others, is that I came from Laredo to Yale as a very confident student. My confidence was shaken because I'd never gotten a C before. And not only did I get a C, I got multiple Cs. And I thought I got depressed. And then I was afraid to ask questions, even in a seminar room, in a group of 20, because, everybody's going to know I was not that, I didn't understand the concept that well. And so suddenly, it could be a pretty rapid, diminishing returns for you if you don't break that cycle. I was fortunate to have a good support system to say, stick it out. We trust you, we believe in you. And in a way, those who give scholarships, that is, donors who give scholarships to a student, in a way, a student doesn't want to fail that donor. And often they'll call the donors, and they get support from them. So I think the teaching academies are a way to have a real thorough discussion about this, about the importance of confidence. Because I think if you lose it, I think the attrition rate for you in college is going to be high, and college is not easy. There are going to be times that you are going to lose your confidence. You just have to have the right people to go to kind of rebuild it. We're all human beings. I mean, we have emotions. Okay. Well, listen, this has been a great conversation with you. Thank you very much for being a part of South by Southwest and the EDU format. Saludos.